Hi, everybody. It's DocTalk. We have officially moved into spring. What a fabulous time of the year. And we're moving out of winter. So, time to kind of wind down the infectious disease talk. Um, our flu levels are down. Our COVID levels are down. Our RSV levels are way down. Norovirus, the little GI bug, is going to continue to be a problem. And I just got to say, it's going to be a problem for a little bit. Norovirus is not seasonal. And as we get into the time of year where we share a lot of meals, do big courses at weddings and graduations and parties of all kinds, that's unfortunately when you get a lot of people sick with norovirus and it gets identified. So don't be surprised when you hear that. It appears a couple years ago that norovirus modified itself a little bit and left more people susceptible to that bug, which is a minor one in terms of not causing long-term problems. But boy, does it disrupt you for 24 hours or a little bit longer. So norovirus, vomiting, diarrhea, not passing blood, you feel just awful, and you're wondering which end to put down, so to speak. The timely topic for this week is allergies. And across essentially all of the country right now, this spring season brings all the pollens. Everyone is allergic to something. It's a question of whether you find out what you're allergic to during the course of your lifetime. And if you're in a place where that allergen is present at the rates that make you so uncomfortable for long periods of time or for short periods of time only when it's high. And so the general issue is we all will find our allergies at some point. And if you're in a place where you're really allergic to stuff around you, you have to think about not living in that place for long or going out of your way to protect yourself. So when it comes to allergies, a couple things that you can do. Number one, you can modify your environment. Number two, you can attempt to reduce your exposures to those pollens. Number three, you can do some medical treatment. So let's step through each of these because they're really important and really have a lot to do with the quality of life. First of all, the environment. If you really can't exist where you are and you're so miserable, you've got to move into a closed environment or move out of that environment entirely. There are people who during the yellow storm time of the season, which it is in the southeast part of the country, and my days living in Atlanta, the yellow pollens come in such high levels they coat things. I happen to be in Georgia this week. It is just starting and it coats stuff. And there are people who literally will leave the area for a couple weeks when these pollen counts are the highest, and they will go vacation or work somewhere else intentionally to be away from it. Those of you in the DC area, when the Japanese trees the apple blossoms are coming out, and you will leave the area for some time. If not, you encase yourself in something that reduces that pollen getting exposed to you. So you can close your windows. You can put your air conditioning or HVAC system on a recirculate, use an air purifier to kind of cleanse anything that you can. And then anytime you go out, you try to cleanse yourself when you come in. And that can mean things like leaving your shoes and clothes outside, taking a shower when you come in, or at least washing your hair and and cleaning your external skin. So all of those things attempt to reduce the count of the allergens inside your home. In your car, you can turn on the recirculating form of your heater or air conditioner, depending on what the temps are, and attempt to keep your car as clean as possible. Some people will wear masks, and allergens in general are big particles. They're bigger particles, and they will be caught in a mask. That does not reduce your absorption through your eyes, and your eyes, therefore, can get goopy and runny and irritated and red during this time of the year. And some of that gets absorbed into your nasal cavity. So you can still get that runny nose, feeling a fullness in your throat, irritation into your lungs, and coughing. So I want to make you aware you can do some things outside that reduce your exposure. Those include don't mow the lawn, don't do gardening during those peak hours. Reduce that insertion of the allergens into your home and into your car. Inside your home, you can use air purifiers. Keep things as clean as possible using HEPA filters on your vacuum that trap those smaller particles. And then the final thing is you can medically treat some of your allergies. Now, that generally starts off with antihistamines, and those are medications like Allegra and Benadryl, and decongestants that include stuff as simple as nose sprays that have some saline in them. There are now Benadryl eye drops for those of you who get really irritated eyes. So there's diphenhydramine eye drops that you can use in your eyes. If that isn't working, then you talk to your physician about even stronger medicines that have some side effects, but our steroid medicines are for people who are really miserable and get into the allergies to the point where it impacts their ability to do their work or to be outside the home at all. And those people oftentimes will use a short course of steroids with names like prednisone. Some children need those during the key periods of time to reduce their propensity to get asthma during this time of the year. So it is the time of the year when we're modifying our way out of the infectious disease and coming into the period of time where a lot of stuff is in the environment, where we're outside more often, and many people have seasonal allergies this time of the year that drive them crazy. Take care of yourself. Probably coming up the next few times, we're going to be talking about sunblocks again and hot weather preparation. But for now, we're going to talk about allergies and keeping yourself in this pleasant time of the year safe in your environment. So, DOCTalk, thanks for being here. Welcome, spring.